Thank you, Rick. I'm proud to be working on Project Opioid Tampa Bay with the Tampa Bay Partnership, Florida Blue, and our many partners. While the data associated with the opioid epidemic paint a clear picture of why we need business, faith, and philanthropic leaders to engage, there are many people and many families like mine for whom this tragedy is far more personal. We would do anything to spare others the devastation of losing a friend or a family member. The family member we lost was my baby sister, Allison Grace. Allison was just 19 years old when she died. A freshman at LSU who worked as a daycare teacher at a local preschool, she wanted to follow in our grandmother's footsteps and become an elementary school teacher. She was spunky, mischievous, big-hearted defender of the underdog who was the glue of our family. She loved music, animals, and adored our nephews. Allison's struggle began her senior year, although we would not find out about her addiction until she was in college. Where did a high school student get turned on to opioids? Straight out of a scene from an after-school special, one of her friends took some leftover OxyContin from her grandmother's medicine cabinet and distributed them around to their friends like candy. Allison got hooked, and a little over a year later, facing serious consequences from LSU and wanting to get clean, she'd reached out to me and asked for help. "Sissy, I think I have a little problem," she said, drastically understating the severity of the situation. I brought in my parents, and after much convincing, we checked her into an inpatient program. Unfortunately, at the time, the life-saving interventions that are so commonplace today were still experimental, and our bias deterred Allison from fully utilizing them. We had dealt with addiction in our family before, but on December 20th, 2013, struggling to get sober again and full of despair, Allison took her own life. As my spouse, my mother, my father, and I were running to save her life and screaming for her to put the gun down, Allison pulled the trigger. We were too late. We were too late to save Allison, and each and every day families are too late to save their loved one. So as personal as this tragedy is, the purpose of this portion of the presentation is to shock you into action, because my family is not alone. 130 families each and every day in the United States lose a loved one to a fatal opioid overdose. That's 130 911 calls, 130 ambulance sirens, 130 firefighter and EMT crews, 130, oh God knows, 130 families broken each and every day. How can we not act? The best way to describe the opioid epidemic is in 3 waves: prescription opioids, heroin, and synthetic opioids. The first wave is what drowned Allison. Prescription opioids, represented by the blue line in the chart, began in the late 90s with the rise of prescription opioid pill mills, oversubscribing, misuse, and abuse. The Tampa Bay area was ground zero for pill mills in Florida, and Florida was ground zero for the U.S. Eastern Seaboard. In the early 2000s, however, and thanks to multi-sector efforts, prescription drugs became much harder to obtain. As one wave subsided, another wave crashed. The reduction in the supply of OxyContin created demand for heroin, which you can see in the pink. Then the black market created a third and more deadly and powerful wave. The red line on the chart represents the synthetic opioids. Synthetic opioids are more potent, more prevalent, and more profitable for drug dealers. See the dose of carfentanil in the picture? That's 20 micrograms. It's like the size of a few grains of sand. It's worth $250, and just that small amount would kill 20 people. You may be wondering why the opioid crisis is categorized as an epidemic. You wouldn't be alone. The World Health Organization defines an epidemic as a sudden increase in the number of cases of a disease, more than what's typically expected for the population of that area. If the number of opioid overdoses in 1999, at the beginning of the chart, is what would be typically expected for opioid deaths, as of 2018, the US had registered 4 times higher than the expected number of opioid deaths. In comparison to other epidemics, the opioid epidemic now has higher rates of morbidity and mortality than the HIV/AIDS epidemic. In 2019, approximately 1.2 Americans were living with HIV/AIDS, and roughly 15,000 people died of AIDS-related complications. Yet during the same year, over 2.29 million Americans were living with opioid use disorder, and nearly 50,000 people died. And if opioid overdose was a category by itself, it would be the 9th leading cause of death in the US, even ahead of fatal car crashes. Since 2015, the Tampa Bay region has fared far worse than Florida and the United States. Tampa Bay's opioid overdose fatality rate of 23.3 per 100,000 population age-adjusted rate is 10% higher than the state of Florida and 51% higher than the nation as a whole. This means nearly 3 people die every single day in Tampa Bay from an opioid overdose. Whether personal, familial, or societal, the cost of addiction is high. Here are a few facts and figures for you to ponder. The cost of the opioid epidemic in the US exceeded $1 trillion between 2001 and 2016. In the same 15 years, the cost to our nation's healthcare and criminal justice systems and our workplaces grew 665%. In Florida, opioid use in 2015 alone reduced our prime age labor force participation rate by 1.7%. That equals 128,000 workers. This cost the state over $97 billion in economic output. In the Tampa Bay region, the opioid epidemic cost our region $25.8 billion in economic output in just 1 year and reduced our labor force by nearly 35,000 workers. This isn't surprising. Historically, the opioid epidemic has been a plight within the working age white male population. And while this population is still disproportionately represented, we're beginning to see some significant demographic changes that we must note. Millennials are dying. Black and Hispanic Floridians are dying. The death rate for Black community in Florida has recently reported an astounding increase of 330% in fatal opioid overdoses and 215% increase in opioid deaths within the Hispanic communities in Florida. Millennials make up only 25% of the population, yet account for 75% of the overall death rate due to opioids. With these new trends, we must rethink our strategies to ensure equity and access to life-saving interventions for these specific populations. Life-saving innovations that reduce overdoses and overdose deaths include recent changes to the system of care. Best practices now emphasize peer counseling, warm handoffs from emergency departments to treatment facilities, and medication for addiction treatment, which is a combination of medication and counseling. These evidence-based interventions have been shown to reduce death in OUD patients by 50%. Naloxone, which comes in an easy-to-use nasal spray, is a medication designed to rapidly reverse opioid overdose by binding to opioid receptors. Naloxone saves lives. That's the part of this epidemic that's so frustrating and so hopeful at the same time. Opioid overdose deaths are almost entirely preventable. Despite these innovations, barriers still exist. They include some very bureaucratic but real issues, including service reimbursement, licensing hesitance, and organizational concerns. Additionally, Florida remains 50th when it comes to allocating resources for behavioral health treatment and services. And most recently, the pandemic has created challenges of isolation, stress, and access, which exacerbated the opioid epidemic. To be clear, the opioid epidemic of 2021 is more virulent than the opioid epidemic of 2019. On top of the deadly synthetic street opioids, the global pandemic has produced drastic spikes of fatal opioid overdoses. Nationally, more than 40 states have already reported dramatic increases in opioid-related fatalities in 2020. A report by Project Opioid out of Orlando, utilizing data from the Florida Department of Health, indicated that opioid overdose deaths may have increased as much as 59% between 2019 and 2020. This same report indicated drug overdose deaths increased in the Tampa Bay area by over 43% on average during the same period. One thing is clear: the opioid epidemic has only grown in scope and impact and requires our intervention now more than ever before. One message we want to impart to you today is this: now is the time to redouble our efforts, forge new alliances, and support those who have been fighting this battle for years. By expanding the table of advocates and concerned leaders committed to combating the opioid epidemic, new energy, new conversations, and perhaps even new approaches to addressing this crisis can emerge. Project Opioid Tampa Bay is committed to bringing a coalition of influential business, faith, and philanthropic leaders together with experienced stakeholders so we can substantially reduce opioid overdoses and overdose deaths by 2025. The cornerstone of this coalition should be and will be the men and women impacted directly by this opioid epidemic, and there are many. To this end, and so we don't lose sight of the human face of this struggle, I'd like to introduce Kirkpatrick. I first met Kirk in 2018 through a mutual friend. I was a newly elected legislator and he the CEO of Riverside Recovery. Kirk shared his story and it stuck with me. I hope it helps us all to pause and reconsider who we think develop opioid addictions. I'm grateful to invite up this dual expert on the epidemic, Kirkpatrick.
Thank you, Jennifer, for that kind introduction. My name is Kirkpatrick. I'm CEO and co-founder of Riverside Recovery of Tampa. It's my pleasure to be part of Project Opioid. What does somebody who abuses drugs, abuses opiates, has a substance abuse disorder look like? Well, frankly, it looks like me. I was born into a very happy family. My father was an Air Force pilot, fighter pilot, had a great mother, very loving. I went to the University of Florida where I played football for Coach Steve Spurrier. I was an All-American tight end. I ended up working for Merrill Lynch, had a great career, married my college sweetheart, had 2 beautiful daughters, had a great life in South Tampa. I started abusing opiates when I had a minor injury, and it pretty much took over my life. They say the chains of habit are too light to be felt until they're too heavy to be broken. Percocet, which was the opiate of choice for me, became my overlord. My work, my marriage, and my children, they fell apart. At this time, my wife divorced me. I was arrested for domestic violence. I got a DUI. As a 45-year-old man, I moved back in with my parents. On August 4th, 2013, I surrendered. I reached out for help. I went to treatment, saw a physician, got prescribed medication-assisted treatment. Opiate addiction and addiction in general is really the only disease that's killing you, but you're too ashamed to admit you have it. I spent over a decade doing that to myself, too ashamed. What's it like now? Well, recovery starts when you reach out for help. You stop playing the angles and you realize there are no shortcuts. It's about learning new coping mechanisms to deal with life on life's terms. Taking ownership of your life and putting your recovery first, that's what it's all about. It's 100% the reason why we opened Riverside Recovery of Tampa. Thank you for having me be part of Project Opioid.